Hello, everyone. Sonia Liebendorfer here, and we're going to be talking today about frontotemporal dementias. And it is the most difficult of the dementias because it strikes people at such a very young age. Before we start going into the different signs and symptoms of the different types and the different areas of the brain that it affects, I want to give a brief overview of the different parts of the brain that we're going to be talking about. So let's go ahead and get started, shall we? The first thing that I want to go over is the different parts of the brain that we're going to be talking about. The frontal part of the brain is right behind the forehead, and it controls all of your personality and your behavioral functions of the brain. The Broca's area of the brain is behind the frontal lobe, and it has to do with your speech, also has to do with the ability to swallow. The temporal lobes of the brain are on each side. And I have mentioned before, your left side of the temporal lobe controls the movement on the right side of the body. And the right side of the brain, temporal lobe, controls the movement on the left side of the body. So they crisscross. Opposite side of the brain controls movement on the opposite side of the body. Those are important to know because those are going to be the different areas of deficits that we're going to talk about today in this presentation. Now, the reason that the frontotemporal dementias are so difficult to talk about is because these are very young people. The onset is between the ages of 40 and 65. These are people that have their whole life still ahead of them, and yet they receive this diagnosis. The tragic thing about this is that so many of them are misdiagnosed as either having some sort of mental illness or Alzheimer's, in which case their treatment is delayed, and that causes even more problems. The main thing is atrophy in this particular part of the brain that's the cause, and it causes changes in their behavior, in their personality, in their language ability, and in some cases in movement ability as well. Now, all of the changes differ from person to person depending on the part of the brain that atrophies. And that's what makes this so difficult to be able to diagnose. Now, some rarer subtypes of this particular type of dementia have movement disorders associated with them that are Parkinson's in nature. And amyotrophic lateral sclerosis has even been linked through clinical research, but more data is needed. So I'm going to talk about on the last slide about referring you to clinical research, especially if you have a history of this in your family. Now, when it comes to changes in behavior, you can see the following. You can see lack of good judgment about making decisions. You can see a loss of inhibition. If they all of a sudden are running around naked, then you know there's a problem. If out, especially out in public, I'm talking about increasing inappropriate social behavior. If they are all of a sudden becoming racist in their nature and they're not normally, then you know that's a sign of an issue. If they have a loss of empathy with their fellow man, if something happens to them and they don't feel bad for them, then that's kind of off. If they have a loss of a sensitivity to the way somebody feels, if they don't care if they hurt their feelings, that's also a sign. If they have a total lack of interest or apathy about things, then oftentimes this is misdiagnosed as depression. And if they have a repetitive compulsive behavior, such as tapping or clapping or smacking their lips or something that they just do out of habit, but not out of something that is that they're consciously aware of doing, then that can also be a sign. If they have a decline in personal hygiene, just don't care if they ever get their hair cut, just don't care if they have any semblance of looking normal, then that can be a sign. If they have changes in eating habits where they're overeating or they're preferring sweets and carbohydrates to eating nutritionally, that can be a problem. If they have, if they're eating inedible objects, you see them, you catch them eating stuff that they shouldn't be eating, then that can also be a sign. And compulsively wanting to put things in their mouth can also be a sign. But there was one aspect of this that I wanted to include here because in other literature I've seen it included under the temporal side of the brain, but I think it falls under behavioral. And that is if they have episodes of either inappropriate laughter, they laugh at things that really aren't funny, or inappropriate crying, they cry over things that they really shouldn't be upset about, then those are also signs. Now, in addition to behavioral type changes, we also need to consider changes in speech and changes in language because Broca's area of the brain is what involves speech. And so we also need to be concerned with swallowing, because those two kind of go hand in hand. If you start noticing that they try to eat their food too fast or things of that nature and then start to choke on it, that can be a sign. There is increasing difficulty in being able to find the right word whenever they talk. If they can't recall the name of an object, then they can just refer to it as it, or sometimes they will refer to it as something else, a made up word, what we call word salad. You have to be aware of that. And increasing difficulty in reading comprehension. The written word becomes difficult for them to understand and comprehend. And there becomes increasing difficulty in understanding the spoken word as well. And a lot of times there can be conflicts because what is said is not how it is interpreted by that person. And so they take it the wrong way, and it ends up being a scene sometimes in public because they interpret things the wrong way. And hesitant speech, sounding robotic in nature and unnatural, can be a problem. And making mistakes in sentence construction when they're trying to convey a thought is also a sign. Then you have to also be careful of the unintended message in things that are said. What they are saying might be not at all what they are meaning to say. So it can cause a lot of relationship friction simply because of a misunderstanding of the way they come across. And you will find too that there are some instances where these people have a large vocabulary when they were younger, but as they get older, their vocabulary starts to diminish because words that they used to know the meanings to, they are no longer familiar to them. And so being able to find an appropriate word can become more and more difficult. Now, we also need to talk about changes in movement. because in some of these, there are difficulties that develop with movement. And it can have anything from tremors to being poorly coordinated to having difficulty swallowing, which really to me falls under more the Broca's area since swallowing and speech are so close together. But problems with muscle rigidity and muscle spasms and even muscle weakness. So these are things that we need to take into consideration if we start seeing problems with movement, that it might be a sign that there is more going on than meets the eye. Now, we mentioned before that this particular cause of this type of the dementia of the brain is due to atrophy of the frontal and temporal lobes, but the the causes that makes it atrophy are really unknown. But I think it has a lot to do with how much you use these portions of the brain and how much they are allowed to be unused. Because you've heard the saying many times, if you don't use it, you will lose it. I think that's very true. And I think people that are socially inept because they spend a majority of their time doing social activities that are isolated, such as video games, where they don't really interact with other people, but it's just between them and a computer. I think those type of problems are things that you would see with the frontotemporal dementias. Now, that is simply an idea on my part, but I think it has to do with social skill as much as it has to do with environmental factors. And by environmental factors, I am thinking that access to medical care would be a huge factor for these people. Not being able to get the proper care that they need might cause these problems to develop early. Also, having a family history makes you have an even higher risk for having these kind of issues. But a lot of people, they have found that more than half of the people that have this kind of dementia don't have any history of family dementia at all. So I think because of that, there is an all encompassing factor of a combination of environment, social, and also dietary and exercise factors that are involved here. Because basically, through research, they found a connection with amyotrophic lateral sclerosis. And they're needing to have further research so they can really truly connect these two illnesses together. But I truly believe that if you don't use all of the parts of your brain, you will start to lose the function that you have. And that's why it is so important to stay on top of diet, to stay on top of exercise, to stay on top of social skills and be interactive, and also to stay on top of doing puzzles and keeping your mind active in front of in terms of activities that you enjoy and you are familiar with, but also challenge your mind by learning new things that you didn't know before. Because it's only by challenging and reaching something new as far as new material or new concepts to learn, that you really can push yourself beyond where you are now. So it is always important to remember to continue learning. If you can just find something that you enjoy, that you can learn new things about every day, just something that you can expand the knowledge that you already have. For instance, say that you have a hobby of fishing. That's one of mine. Say you spend some of your days, you decide that one of the things that you're going to do is learn about different types of fishing. And there's all kinds of things that you can explore with fishing. You can look at different types of salt water, different types of fresh water. You can look at different rigging. You can look at making your own lures. You can look at learning fly fishing. I mean, you understand the ideas that you can come up with are endless. But the point is to find something that interests you and to focus on learning more about what interests you so that you challenge yourself with classes and being able to learn new things. Another good outlet is continuing education classes at a local college. Who says learning ever has to stop? If you don't do that, consider taking up an art class or a ceramics class or pottery class, whatever interests you, whatever you wanted to learn but you've never taken the time to actually do, take time to do that and make time for yourself and challenge yourself to learn new things. By challenging your mind, this is how your biggest asset is to guard against this type of disease, is to keep your mind functioning and fresh and force it to absorb new material daily. Now, just as in the other types of dementias, the diagnosis for this is pretty much the same. You can have a CT scan that'll show if there's any kind of atrophy in the brain that they're seeing already. You can also rule out a stroke. You can also rule out the vascular dementias this way. It will also be helpful to have an MRI because it provides more detail than what a CAT scan will. And we already talked about the importance of having the MRI at least 24 hours after a CT scan because if there is some type of blockage or occlusion of the vessel, it does not always show up right away on a CT scan. That it is beneficial for a MRI to be done 24 hours later because it allows time for that blockage, if there is one, to actually show up. Also, we talked about the use of the PET scan, which I have not seen used here, but I would love to see it utilized more because they can show the areas of the brain where the nutrients are very poorly metabolized and not used. And they can show where the degeneration process has started to occur in the brain. And this helps them to diagnose the type of dementia that they're dealing with. Also, the neuropsychological testing that can be done by a special psychologist that helps them to find out what problems they have with memory, what problems they have with being able to handle abstract thought. That type of testing is also helpful at an early stage to determine what type of dementia that you're dealing with. You can also do a sleep study because in many types of the dementias, If there are problems with the REM sleep, the rapid eye movement sleep, if there's problems with sleep apnea that aren't diagnosed, all of these factors come into play when you're talking about a dementia diagnosis because sleep deprivation and oxygen deprivation occur with sleep apnea. The body doesn't get enough oxygen, so the brain becomes oxygen deprived and it can cause memory problems. Also, it is important to do blood tests to rule out any liver, thyroid, or kidney problems that may be causing the symptoms because these can also have an effect on how well you can remember and how well you can retain things. So, all of these tests are very important when coming to a diagnosis for this type or any type of dementia. So, what type of treatments do they do for this type of dementia? There are a lot of things that they can do as far as physical therapy. If there are movement problems, they can do speech therapy for people that are having difficulty with speech or with swallowing difficulties. The drugs for Alzheimer's don't really work, and that's why it's one of the ways they figure out misdiagnosis is if somebody is put on the Alzheimer's medications and they really don't do them any good. Some people are put on antidepressants and they have found them to be helpful for them, and others have been put on antipsychotics and those have been helpful for them. So it all depends on the person, it all depends on the deficits that they're having, and it all depends on the types of things that they need treatment for with this particular type because it can range so much between behavior, between mood, between speech, and between movement. There's so many varying components that it's really important to make sure that once you start medicating that you get the medications right. Now, for a person that is diagnosed with frontotemporal dementia, the lifestyle changes are very important. Regular exercise for at least 30 minutes a day to really get those endorphins to kick in, and that's the feel good hormone, is really important to help them offset feelings of despair and feelings of depression. Also, diet is very important, and they have said multiple times that the Mediterranean diet is very good for a diet consideration because it is heart healthy, it is low fat, it is high in vegetables and fruit. So remember to consider diet also as an important aspect of treating this disease. Make sure that you remove clutter, especially if they're prone to falls, that you get all the unnecessary furniture out of the way. Make sure that you get the throw rugs out of the way that they might trip over if they're having difficulty picking up their feet, which is a Parkinsonian symptom that might present. Also, being able to tell how far to pick up their feet is one of the Parkinsonian symptoms that might present. And being able to prevent falls as much as possible by getting things out of the way that don't need to be there. If there's a bunch of excessive furniture that they don't need, then get it out of the house. You don't need anything that's going to cause a trip and fall issue. Also, remember what I said about making sure that you have good, sturdy shoes. No shoes with flat, floppy backs on them. No shoes that have no support for their feet. Make sure you get a snug shoe that has a non slick bottom that will stick to the surface and help them when they walk. Make sure that you also have handrails installed to assist to get in and out of showers, in and out of the tub. However, they're bathing, make sure you have handrails available for them. Also on walkways, make sure you have handrails to go up and down steps. Raised toilet seats to help them get up and off the commode. Anything you can do to help them with ambulating and with getting around is going to be beneficial for them. Do as much as you can to maintain a calm environment, provide them with structured routines, make tasks simple for them so they don't get frustrated, because they can reach a point that they get frustrated very easy just trying to do simple daily tasks. And it's best to learn techniques that you can easily distract and redirect them whenever they start having problem behaviors and get frustrated. And you can learn those from Tipa Snow. She teaches that as a caregiver. She teaches caregivers how to redirect on her website. So I have her information again at the end of this to provide for you to make sure that you follow through with her program, because she's been working with dementia patients for over 30 years. She knows the techniques to use to elicit cooperation. So it's best to go to someone like her that is an expert on understanding how to communicate with them whenever you're dealing with this type of situation. Now, caregivers for the people that have this particular type of dementia have a tremendous challenge. And it's due to personality changes. You never know who you're going to be talking to or who you're going to be dealing with when you go over there to meet them. They can be very inappropriate. They can put you on the spot in a social situation. They can have all kinds of behavioral problems that develop that increase the stress, especially when they start, they can get paranoia, worried that you're stealing from them, or if they develop hallucinations, sometimes it's difficult to bring them back to reality. But there are tools that you can use to try to assist with that, but it doesn't make it any less stressful when you're out in public and they start to act out. It is very important as a caregiver that you have some type of outlet, some type of hobby outside the home that you can enjoy to help ease this tremendous amount of stress that you are under taking care of this person. And it is very important that diet and exercise are important for you as well. So make sure you get at least 30 minutes of exercise to get those feel good hormones, those endorphins to kick in. At least make sure that your diet is a healthy one. If you are into the Mediterranean diet, fine, wonderful, perfect. If you're not, then make sure that you're eating a diet that is good, because they have found that diet has a lot to do with how we are later on in life. So it's important that those two things are in the forefront of your mind, even as you are caring for someone else that is having issues. Please, 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 if you have not yet looked up the information that I've provided on Tipa Snow, please go to her website at tipasnow.com or go to YouTube and search for the videos about Tipa Snow and dementia, because she helps you understand the different types of dementia, the different stages of dementia, and how it is best to relate to somebody that's at each stage. She is a tremendous resource because she's worked with these people for over 30 years. She understands the way their minds think, and it's just amazing to watch. And I have learned so much from her, and she has a conference, a virtual conference coming up in November, in which she's going to be doing some teaching, and it's called a PAC conference on the positive aspects of care for someone that has this. And being able to give positive, effective care is definitely something that is worth your time. And if you have the time to devote to taking her classes, then I'll see you there because I have signed up for her classes. They are going to be in November. But it is so important to do as much learning as you can to be able to deal with learning how to communicate on their level depending on where they are on this continuum. Now, she covers everything from how to handle a person who is having hallucinations and they aren't facing reality at all at the moment to teaching on the signs and symptoms of the early dementias on all the different types. She covers everything from A to Z. So if you have not looked at her website yet, I encourage you to please look her up and get familiar with her content because I can't wait for her seminar in November because every time I listen to this woman and listen to her presentations, I learn something new. So I really look forward to listening to her every time because even though I've worked in the medical field since 1996, every time I sit down and listen to any presentation that Tipa gives, there is some jewel of information that I can come away with that I can apply to the situation that I have in dealing with my mother in her present state. So I encourage you, if you have any family members that have dementia, please plan to be at her online conferences in November because she's going to be doing a lot of teaching and it's going to be really a lot of good information for her to put out to help us understand living and dealing with people that have dementias. I cannot emphasize enough if you have a family history of some sort of dementia, it is so important that you get involved in the clinical research that they are doing to help them get a better understanding of the dementias, of what causes them, of what we can do to treat them, of what we can do to prevent them. So, if you have an opportunity to participate in clinical research, please do so to help us advance the science behind understanding this disease. Now, the main thing that I want you to know is that there might be some factors, such as with the virus, that you find may limit your ability to participate. In other situations, you might be like me. I tried to participate in a study that had to do with different types of illnesses that are hereditary. And they found that my saliva sample, for whatever reason, does not provide a complete DNA sample. So they sent me another one. They repeated it and they had the same result. For whatever reason, they could not get a complete DNA sample from me through saliva. So I was not able to participate in their study. At this particular time, I'm not in a position that I could move closer to where they are. Otherwise, I would love to participate in studies that they have. However, if you are in a position that you live close enough to one of the research centers, please get involved in this, especially if you have a family history and you're able to do so, because this is the only way we're going to be able to get a better handle on these diseases and be able to find treatments for them and be able to stop them in their tracks earlier after years of research. Thank you so much for your time and have a wonderful weekend. I'll see y'all next week.